Hi, everyone, and thank you for joining us today. My name is Tung, and I'm the lead physiotherapist, and I've been with XR Health for the last 4 years. And welcome to our next webinar in our series. Today, we're going to cover VR therapy through an occupational therapy lens. It's a pleasure for me to introduce you to one of our OTs, Tim, who will be the main speaker for today. Over to you, Tim.
Thanks, Tung. All right, let's get started. So hi, everyone. Thanks for joining us today to discuss this webinar, which is titled Virtual Reality Through an Occupational Therapy Lens. I begin today by acknowledging the traditional custodians of the land in which we meet, the Wurundjeri people. I pay my respects to elders past and present, and I extend respect to Aboriginal and Torres Strait Islander peoples here today. So like Tung said, my name is Tim. I'm an occupational therapist and have been for the past 4 years. I've been working in the disability, pediatrics, and neurological rehab space in the past, and most recently working in upper limb rehabilitation. I've worked with XR Health since February of this year, joining the team in a full-time capacity. I work primarily and exclusively with pediatric clients, with over 90% of the clients that I currently treat having a diagnosis of autism spectrum disorder. Outside of working as an OT, I'm a massive video game enthusiast, if you can't tell from the background behind. I collect retro video games, and I also run West Australia's largest gaming expo in my spare time. Massive Dungeons and Dragons nerd. I've been a cosplayer for 15 years, and I travel around Australia attending events, spreading and promoting the good word of all things gaming. So XR Health for me is a no-brainer, and it's a great opportunity for me to combine my love of video games with my passion for occupational therapy in order to help neurodivergent patients reach their occupational therapy goals. So a little bit about XR Health. If this is your first webinar, I just wanted to do a quick overview of our company. XR Health is an international company, so we have teams here in Australia, we have a team in the United States, and we have a team in Israel and in Spain. The team is roughly divided into clinical and product developments, which take care of the game and the software manufacturing and development, while the clinical side is where I work. So today I'm going to run through the clinical side of what occupational therapy can provide for clients in tonight's webinar. So some learning objectives that we're going to go over today. So we're going to look at the role of occupational therapy for autistic individuals, how occupational therapy uses VR in therapy sessions, and how occupational therapy can help patients reach their functional goals. But before we get into all of that, we have to address what is occupational therapy. And it's a very common question that we get asked as occupational therapists. And the main one we always get asked is what's the difference between OT and physio? So I'm here to answer all those questions. So occupational therapy enables people to participate in activities that they find meaningful. It's a profession that involves the use of assessments and interventions to develop, recover, or maintain meaningful activities or occupations of individuals, groups, or communities. So these activities can include tasks such as taking care of yourself or others, working, volunteering, participating in hobbies, social events, and interests. Occupational therapy is a really wide scope of practice. We're trained to cover a wide range of areas and then specialize in a space after we finish our training at university. OT can work across pediatric populations. We can work in aging populations, disabled individuals in the mental health space, upper limb rehabilitation, return to work. It's a massive scope of practice. But one of the core things that all of these different areas of practice have in common is the word occupation. And every single person that engages in an occupation, or sorry, every person engages in an occupation in one way or another. And a common misconception we see as OTs is that people assume incorrectly that occupation is what you do for job or what you do for money or what you do for work. It's only just a small component of what we actually look at. So let's break it down a bit further. What is an occupation? So it's not just a job, but it can also be a job, which is where it gets confusing. So occupation in the OT space is defined as something that occupies your time. So it's quite literally in the word itself. And something that occupies your time can be anything. It can be your day job. It can be maintaining a household. It could be brushing your teeth. It could be going to sleep, which is my favorite occupation. It could be anything that occupies your time, conscious or not. So occupation can be broken down into lots and lots of different categories, but we've got six here that we'll talk about briefly. So we've got work, leisure, play, social, ADLs and IADLs, which is your activities of daily living and instrumental activities of daily living, education, and play. This is a really basic framework that we as OTs use to help identify occupational imbalances within our clients and what might be affecting them to help work them towards their capacity goals. So we'll take one of those examples that I said before and break it down into one of these sections. So an occupation that we see quite often reported by parents is brushing of teeth. So that seems to be a really common issue for young people or autistic individuals who are children. And it seems to affect routine a lot within what we see with our clients. So let's have a look at it. So is a nice little occupational analysis. So this is something I've quickly Googled. I found a really nice picture which you can print up, stick on your mirror at home, and it breaks down brushing your teeth into five seemingly simple steps. And for a neurotypical person, you can look at this and say, yeah, okay, that kind of makes sense. That seems like the basics of brushing your teeth. And it seems quite simple. But when we start working with neurodivergent people or autistic individuals, a task like brushing your teeth is actually far more complicated than what you would have believe. So this is where our job starts coming in. So I've done a far more comprehensive occupational analysis of brushing of teeth, which I've broken down into 35 steps. This isn't an exhaustive list of exactly the steps of brushing your teeth, but this is what I could think of every single step from picking up the toothbrush to putting it down back on the table. So as you can see, it's a pretty overwhelming, exhausting list of all these different components that make up such a simple task or a simple occupation. And like I said, this doesn't include the lead up to brushing teeth and what comes afterwards, which is a whole separate situation. So as an OT, we can look at any one of these 35 steps and pick out with a parent or with a child or whoever, this is the area that we're struggling with, and what can we do to break that task down and figure out what within that occupation is causing the concern or the difficulty. So we can look at things like environmental factors, we can look at sensory factors, we can look at all these different components of that one part within the occupation to try and come up with a solution that's going to work for that client. And by looking at this list, we can talk to parents, we can listen to feedback from our young clients, and we're able to analyze and suggest strategies for the family to assist within this occupation. So that's occupational therapy in a very, very brief nutshell. So we'll move into autism spectrum disorder. So what is autism spectrum disorder or ASD? It's a neurodevelopmental disability caused by differences within the brain. It affects social interaction, communication, and behavior. The term spectrum in ASD refers to a diverse range of symptoms and severity and typically begins in early childhood. And as an OT, we see autistic individuals with difficulties functioning socially at school and in the workplace for our older clients. Each autistic individual has a unique pattern of behavior and different levels of severity. Some of the common symptoms that we see in our autistic clients are difficulties with social interaction and communication, such as failing to respond when their name is called or seemingly not hearing you at times. They could potentially have poor eye contact or lack facial expression. And from a behavioral standpoint, we see and hear reports of behavioral patterns, including engaging in repetitive or rigid behaviors, reports of resisting cuddling or touch, and a preference to play alone. Autistic individuals may have intense interests in specific topics and may struggle with things like sensory processing as well. And sensory processing challenges is an entirely separate presentation on its own, which we might do one day in the future. Each client presents their own unique strengths and challenges, and it's my favorite part of this job and working in this space is that every client presents a unique set of symptoms to them. And you may see that symptom similarities across multiple clients, but the solution or the assistance you can provide to that specific client is unique to them. And that's what makes the job so rewarding, is that when you find what can work for that person and works for that family, it gives you that sense of like, oh, I finally got that connection. I finally found something that can help this person. Even if you've got two clients that have a sensitivity to noise, the solution to that problem may be entirely different. To be able to engage them in the sports carnival where the whistle's blowing in the background, there's lots of kids cheering. So it's a pretty exciting space to work in. So occupational therapy plays a number of roles within the ASD space. OT supports autistic individuals improving their communication skills, enhancing their play abilities, and facilitating positive interactions. We can look and analyze a number of factors, including environmental factors, such as helping individuals adapt their environment to help enhance everyday functioning at home or at school or within the community. And we can also provide comprehensive assessments to help assess a variety of aspects, including motor skills, sensory processing, emotional regulation, cognitive abilities, and interactions between parents and caregivers as well. And then from there, we can use that information from the assessments and from our interview skills to create programs that are custom tailored to address specific needs for that client. And these programs can focus on things like self-care, they can focus on fine motor, school and work-related tasks, meal preparation, and community participation. So all of those occupations that we talked about before. Some of the benefits of occupational therapy for autistic individuals can be improved sensory processing through interventions that target sensory regulation, which is a huge component of our job, and then helping individuals respond rapidly or better to those sensory inputs. We can look at enhancing motor skills and coordination, where we focus on developing fine and gross motor skills necessary to engage in those daily occupations. We can increase independence, which is something that a lot of parents are concerned about, is their child's ability to be independent in certain daily tasks. And we can work towards goals such as dressing independently or self-care routines or managing a routine or functioning skills. We can look at social skills and participation by assisting individuals engaging with others and participating in social occupations that are suitable or required for them in a school environment. We can look at minimizing repetitive behaviors by developing strategy designed to help reduce the amount of repetitive actions often observed. We can look at stress management, skill building by helping manage stress and build stamina within a physical space to enhance recreational abilities. And we can also support daily skills such as cooking, cleaning, dressing, folding laundry, all of those seemingly basic tasks that help prepare young people for teenager and life as adults as well. So occupational therapy uses an individualized approach, which I sort of touched on before. So each client's need, like I said, is unique, and the OT programs that we developed are designed to address those specific challenges and goals. And OT plays a crucial role in promoting independence, well-being, and quality of life for our autistic clients and individuals that we see. So how does this all fit within the VR space? XR Health is a unique business that provides accessibility and accessible therapy through a modern lens. We're able to provide services to families and clients in rural locations who can't afford to be on an OT waitlist for 3 years. Some families really do struggle as well with the management of an appointment. It's again looking at that occupational analysis. It's not just going to an appointment, it's preparing the child for the appointment, getting everything ready, getting them after school potentially where they're already exhausted, then to drive to the appointment, sit in a wait room, talk to a receptionist that they don't know, then sit in an unfamiliar environment, talk to a stranger for 45 minutes, get back in the car, go home. It's this massive task that just becomes really overwhelming. And our service removes that anxiety and that fear for those patients where they can sit in the comfort of their own home and engage in OT and focus on what they're there for, which is the occupational therapy side of our business. Many clients that we see have already been treated by OT in the past, and they have a high understanding of what the services are that we provide. And many clients come to us because they like the accessibility of the telehealth service. And most importantly, the child has an interest in video games. And that's the big thing about all this. So VR is a great tool for us to create buy-in for those young clients. And it's handy not just for the games that we'll go over in a moment, but for building rapport and trust in those clients who may not be interested in traditional face-to-face therapy. Using video games as therapy, especially for young children, is a really powerful tool. A common comment that I'll hear from parents is something like, why can my child play Fortnite for 10 hours straight, but they can't do 10 minutes of homework? And when you look at it, video games are designed to reward their players immediately. There's an immediate reward as soon as they finish a task. It's what makes them fun. And that's the same concept that we use with the VR headset. We make therapy fun to create buy-in and also have a therapeutic effect at the same time. We can look at things like memory. So we have, clients that will say, I'll ask, or they'll report my child has a really poor memory. I don't think their memory is very good. And I'll say, okay, do you, ask them to take out the garbage how many times? And they'll say, oh, 50 times, and they still don't do it. But then when I'll talk to the child, I'll say, oh, hey buddy, what's your favorite Minecraft character? And they'll talk about 50 different Minecraft characters in 30 seconds. So it's about creating a difference between memory and attention, and that video game aspect and that reward behind it is what sort of drives this VR technology. There's a lot of satisfaction in playing video games, which is where we use that to create buy-in with our clients and then use it as a therapeutic tool. And for XR Health, our OT appointments are structured as an initial assessment, which can go for around 2 hours, which is generally an interview with the parents, and then a report that follows up, and then our VR sessions, which go between 45 and 55 minutes. And we drop straight into the VR at the second appointment. So let's have a look at some of the games that we play on the headset. So there are dozens of programs available within the XR Health headset. The most common question I get asked at the initial assessment, usually by the child, is, "Can I load my own games onto the headset?" Very popular question we get asked, and the answer is no. And the reason for that is the headset is a registered medical device, and all the games that we have on the headset are approved through a medical board for their therapeutic benefit. So I've listed 4 games that I most commonly use with my clients, but it's not an exhaustive list of what we can use with them. The games listed are Color Match, Balloon Blast, Memorize, and Create XR. So each of these games are really unique in that the service that they provide or the skill set they provide within the game can be used across multiple different professions. So we can use Color Match as an example from an occupational therapy point of view. We can use it from a physio point of view and a psychology point of view. And even though the games are the same theoretically, they could be used for very, very different reasons, which is what keeps the games fresh and exciting and engaging for the young people engaging with them. So we'll talk a little bit about Color Match. So Color Match is a game where the users have different colored gloves or their controllers, and they need to hit a series of colored targets that match the colors of their gloves. So the game can be set to a number of different combinations and difficulties to help grade and adapt for the client. And the combinations are helpful for us as OTs because we can set different parameters for the clients to play, which then challenge different areas of the body. Color Match helps build capacity for areas such as body coordination and proprioception, which is a fancy way of saying the body's awareness of its position in space. It's a big passion project of mine. Again, separate presentation for another time. But very quickly, an example of proprioception would be walking. So if you think about it when you walk, you don't look where your feet go. Your body knows instinctively where to put it so you don't fall over. And that's what we look at with proprioception. So it's that positioning within space. Cognition, which is another big one for occupational therapy. So we look at things like motor planning, executive functioning, which we can see when we have a client with 2 different colored gloves and we ask them to match the color targets that appear on the circles to the same color glove that they have on their hand. And then we can add a layer of complexity by asking them to do the opposite. So having a blue glove hit a purple target, for example, or a purple glove hitting a blue target. We can look at things like impulse control. So we can add colored targets in that don't match the colors of the gloves. So we've got blue and purple on the screen at the moment. We can add in a random red or a red or a green target that the client doesn't hit. So they have to hold that restraint back and it breaks that movement pattern so they don't get stuck into a repetitive cycle. And we can look at things like attention control. So we can make the games longer. So we can go from a 1 minute game to a 10-minute game over a period of time to increase that attention capacity. Balloon Blast is definitely one of our more popular games. It requires the participant to use the controller like a sword and swipe through and pop balloons as they appear in front of them. It's definitely one of the more physical games that we offer, but definitely, like I said, one of the more popular ones. Balloon Blast helps in building things like bilateral coordination and hand dominance versus non-hand dominance. So what I mean by that is using 2 hands to sort of cross over the midline, or we can set up the game so all the balloons appear on the left-hand side of the screen, while the sword is only programmed to be on the right-hand controller, so they have to cross over and try and swipe the balloons across their body, which then leads into trunk and core control. So we can ask them, to stand up and move their body to try and build more of that core strength and more of that trunk capacity. And then again, while they're standing, we can look at things like balance and upper body strength, which sort of dabbles into that physio space as well. But from an occupational therapy perspective, coordination and core control is really critical for young people to help them engage in their occupations within the play space, such as sports. So poor coordination is something that we see a lot of, and it can really impact a young person's ability to engage in occupation with their peers, which can lead to a lot of fear and anxiety, especially around playing sport. And this creates a safe environment where they're not going to be experiencing any fear from their peers, and they can practice and build those skills in a safe, controlled environment while still being fun. And additionally, Balloon Blast can be used in a space which I really have a lot of passion for, which is handwriting. So looking at building core and trunk strength again to build endurance and capacity for writing for long periods while maintaining good posture while writing as well. So it's a pretty adept program that we can use for our clients. Memorize, which is definitely one of the games I use a lot in therapy. I try and use this at least once per session with my clients. Memorize requires the participant to use their cognitive skills to remember objects and then pick them up from a conveyor belt. So there'll be a number of objects that will appear on screen. They'll hit start, and then the conveyor belts will start, and they'll have to try and pick those up out of a lineup of multiple different items. Memorize targets physical components such as bilateral control, hand-eye coordination, again, crossing that midline. If they're right hand dominant and they want to pick up the item from the left hand, they have the option to do that. But it also works on that cognitive component. So short-term memory, sorry, executive functioning, attention, impulse control, and task initiation. So it's a pretty multifaceted program that we use. And we can change the parameters of memorize as well by increasing the number of items to memorize. So we can go from one all the way up to five, six, seven. And we can change the number of belts that appear on the screen. So we can have one belt, two belts, three belts, and four belts. And then once a client masters those areas, we can then increase the speed of the belt, which then makes the items come towards them a lot faster, which then works on that pickup time. And the last game that we'll briefly touch on is Create XR, which is my personal favorite space. I'm a very creative person, so this sort of gravitates towards what I like to do in therapy. So it's an open three-dimensional space that allows clients to draw, express themselves, and create some really amazing pieces of artwork. Create XR has a number of features, including a collaborative setting, which means I can use the headset that I have at home to join a room that they're in, and then we can see what the other person is drawing in real time, and we can create all kinds of things. So it's really limited by the creativity of the client and the therapist that's working with them. And it's a sandbox type game, so you can create anything that you like within what the controllers allow you to do. So I use it for creating tasks around handwriting or working with like certain goals in mind, drawing things to reflect on self-identity or drawing interests, things like that, and then has a side-on effect where it's working on upper body and proprioception because they're drawing within that three-dimensional space and creating those objects. And the most interesting thing about this space is you can actually observe the clients in the headset relaxing when they get into this space because they realize they have a creative license to express themselves, and all of a sudden their anxiety of talking about their feelings or expressing sort of washes away from them. So it's a really rewarding game to play with a lot of our clients. So yeah, these are just four of the programs that we use within the headsets to help our autistic clients reach their occupational therapy goals. And that's all I have for the presentation today. So I think we didn't say this in the start, but if there are any questions, please pop them into chat and Tung can read them out or I can have a look at them as well. Anything I can't answer, sorry, Tung will probably jump in and answer
Yeah,
as well.
absolutely. Thanks so much, Tim. That was awesome.
Sorry.
So we've had a few questions come through. One of them was, do you do functional capacity assessments?
Yeah, great question. So absolutely, we have an OT and a new OT starting that has capacity for functional capacity assessment. So it's definitely something that we offer as a service for sure.
Yeah, awesome. And just a little bit on the admin side of things, they take about 10 to 15 hours. So that'll just depend on like the complexity of the client and speaking with the OT and what needs to be done. And it's billed at 193.99 per hour. Um, and you will need to do at least an initial occupational therapy session for an FCA to be scheduled. Let's see here. So, oh yeah, do you do letters for assistive technology or consumables?
Yeah, really good question as well. So definitely if there is any kind of AT request, it is limited to an extent that is telehealth. So things like wheelchair provision are a little bit tricky for us to get approval for because we can't physically access a client in person due to the nature of telehealth. But yeah, I feel like every week I'm doing AT requests or assistive technology requests for iPads and various things like that to help a lot of children reach their goals within like school settings and at home. So yeah, definitely something that we can provide.
Awesome. Um, got someone who's asked, can clients come to the office to use VR or does it have to be external? So I guess offsite.
Yeah, so no, don't have to come into the office at all. It's all telehealth from home. So the headset gets sent out to you after the initial appointment. We do a screener to make sure that yourself or the client is eligible for the VR program, and then we send out the headset following that appointment. So it'll be in the comfort of your own home. I've got some clients that do it at school, and a couple of clients that do it at their office as well for some of the older clients. So yeah, there's a bit of flexibility in where you can do it.
Perfect. We've had someone ask if we can also use virtual reality for emotional regulation.
Yes, potentially. It's so OT is a very broad scope of practice. So we do dabble in it in a sense, but for some of those more high-end emotional regulation where it's a really core goal of that client, we usually defer to psychology for that type of input. But it's something that we definitely work on as part of the fun component of the assessment for sure.
Perfect. Someone asked if we're NDIS registered. So we're not registered providers so that we can see agency managed, but we do see self-managed and plan managed clients, participants. Yeah. Let's see. So what does initial assessment include?
Yep. So for us, it's a 2 hour booking of the appointment. So we usually do 1 hour of interviewing and 1 hour of the report following. The report generally doesn't get sent out to the parents unless they request it, which yeah, we're happy to send out. But it's a chance for us to gather a lot of information. And what I sort of touched on before is that a lot of our clients have already seen an OT before, so they usually know the questions before I even ask them, which means that I can really dig deep and get some really critical information to make that therapy plan a lot more efficient for that person. So it's not just like, oh, he has problems going to school or he has problems with X, Y, and Z. We can really just nitpick out and try and find those exact things that we can sort of target within the VR sessions.
Awesome. Someone asked. So you did touch on some similarities between like physio and OT with using some of those applications. So what are the similarities and what are the differences with physio and OT?
Oh, it's a really controversial question, especially because Tung's a physio, so I'll try not to upset Tung and
I'll just jump in
yours.
when something's upsetting that's been
Yeah,
said.
perfect. I'll do my best. So the way that I used to think about it when I was a student is that physio gets you out of bed, OT looks at where you're going next. So it's looking at so physio is more of and this correct me if I'm incorrect, it's more of a physical muscular approach to therapy. So it's looking about how the body moves and what you can do with those muscles in order to do what you want to be able to do, where OT is more focused on those occupations and what you want to engage in. So, what are the barriers to you wanting to go and ride a bike, for example, or what are the barriers for you going to work, or getting out of bed in the morning or sleep? And that's where the OT scope gets really specialized. So, I've got friends that work in a sleep clinic, I've got friends that work with surgeons doing post-op care. So, it's a diverse scope of practice that OT is, and they teach you lots of little skills at university. But generally, once you leave university, you try and tend to specialize into one area. And for me, it's pediatrics and upper limb. Those are my two passion areas.
Yeah, absolutely. I think Tim's pretty much hit the nail on the head. Um when I talk about physio in a very like simple way, it's yeah, we help people move better. So, why is it that you can't move or do the thing that you want to do? And you're right, we do look at it in a very physical way. So looking at like strength, weakness, like coordination, range of motion, and all that sort of stuff. Um, Whereas, say with the whole, brushing your teeth, like 35 steps, you're looking at each 35 step, whereas we might, like physios, will look at the more physical part, like is it because you can't lift up your arm? Okay, well, if you can't, then let's give you exercises to help with that.
Yeah.
Um, yeah, that sort of thing. So definitely goes hand in hand, though. Yeah,
Mm,
absolutely.
yeah.
Someone's asked, can therapy with XR be multidisciplinary? Absolutely. So yeah, we've got OT, psychology, and physio. We've got clients who access one, two, or three of our services, and we can sort of like divide that up into like weekly rotating between all of those services, and have those multidisciplinary meetings about clients when they come up, so that we can, you know, better take care of our clients and look at the whole person. Let's see. How do we book an appointment with XR Health? So give us a call on 1300 or you can send an email to officeau@xr.health. All of the details are also on our website, and you can also message and email, call and email those numbers and emails on the screen at the moment, and we'll speak with you and get in touch. One of our awesome office team will get in touch. Let's see. Will XI Health move into the speech therapy realm? Interesting. I believe we are thinking, talking maybe about that. I guess watch this space. So unconfirmed for now, but yeah, watch this space is all I'll say. Um, cool. So let's see here. Other questions that I've gotten. Cool. So someone's actually asked, what is a functional capacity assessment exactly?
Oh, it's a tricky one for me to answer. So my scope of practice hasn't had much experience with FCAs. It's not something that was implemented when I went through university, as far as I know. But my understanding is a review as part of your NDIS plan. A functional capacity assessment is required to look at it's going to sound really silly, the capacity of the individual's ability to function within their daily life. So it's looking at all the barriers that that person experiences and then what level of support is required. So it's a pretty critical piece of information as part of that person's NDIS plan to try and get more information and trying to support their funding every time they have a review.
Yeah, that's definitely like the most important part is just highlighting the need for funding in those various areas and
Mm.
like gathering all of that information into like one report. So yeah, definitely really important to have those when we're working with within the NDIS. Let's see here. Someone's also asked for OT, do you have therapists with experience of children with a PDA presentation?
Ooh. Not that I know of. Let's do. Oop. I haven't
That's
seen that diagnosis personally, or at least that acronym. Are you able to expand on
let's see.
EDA? I think Tung's doing a little background research.
Our psychologists do.
Ah,
Yeah. Um, our psychologists do. So I would say that if you have a family member or a client that needs to see someone and they have pathological demand avoidance, then best to speak with one of our office staff and book in with the right psychologist. Yeah.
mm, yeah, for sure. Um,
Uh, okay. So for the next question, how do you measure changes in real and functional outcomes if intervention is virtual reality?
So from I guess a VR point of view, so the VR is really intuitive in that it tracks every movement that the person makes while they've got the headset on. So if we're working in things like one of their NDAS goals is to work on their improvement in sport, and one of the functional problems they're having is with coordination, we can look at their coordination results through the data that the VR headset records. So we can go in, we can look at their rate of success, how many balloons, for example, in balloon bars they're able to pop in a single round, and we can look at that data and compare. And then we use that information to then have the conversation with the child or with the parents and say, is there a difference? Are you noticing a difference when you play sport? So in that sense, it is anecdotal, but we have the data to say, okay, there is a real difference. We can see this patient is improving with their scores through the use of the VR, and their occupational performance or engagement is improving because they're playing more at school. So that's what I use, I guess, as a tool to sort of see if the VR is working.
Okay, awesome. Let's see. Someone's asked, do you have any training for other OTs to learn to use this specific tech? Yeah, good question, Chloe. I think if you send us an email or a call, we can organize a meeting with you. So we've certainly worked with like other physios and OTs and psychologists, outside of XR Health, and figuring out what that looks like. So yeah, let us give us an email, Chloe, and we'll get back to you and set up a meeting. Okay, perfect. Okay, let's see. So another question we had. Where's it gone? Right, guys. Oh, yeah. So, do we need like a laptop for the video calls? Yeah,
Yeah,
laptop computer would be ideal, but certainly phone and tablet is all good as well. Just anything
sure.
with internet and a video camera and a microphone, really.
Yeah.
Okay, perfect. Any other questions at the moment, guys? Please send them through. We've still got a bit of time to cover off any questions that might be coming through. Um, let's see. Oh yeah. Question about can I use my own headset? So no, like Tim was saying earlier, it is a supplied headset with all of the applications and games on the headset already, which is why it's a TGA and FDA registered medical device. Just because like everything is curated and yeah, specific for medical reasons.
Mhm.
Okay, let's see. Now, do you just use the headset like during the sessions?
Yeah, that's also a really good question. So, I feel like the VR headset is a little bit like forbidden fruit. And I mean that in that if it's sitting at home gathering dust, waiting for the next therapy appointment, it becomes more tempting to play. So, what I really like about the software is that it has what's called a digital treatment plan or my treatment plan. So we can play a series of games together in a session. I can then set up a weekly schedule, which I usually do at the end of the appointment with the caregiver or the parents or the client or a combination of all three. I say, right, what games do we enjoy today? What can I set up for the next week or 2 weeks in between our appointment that we can set to it? And it gives us a compliance report as well, so we can see the games that the client is engaging with, or we can see what games they're not engaging with. So it's pretty diverse in that sense. But yeah, we can definitely set up the headset to be played afterwards. But that also doesn't stop our participants from playing the headset in their own time as well. So they're more than capable of going in or more than able to go through and select certain games to play whenever they like.
Perfect. Okay, awesome question here. So, and probably a bit related to the question about demand avoidance as well, but also how do you go engaging with those participants who just like struggle engaging with any kind of therapy?
Mm. It's I guess one of the advantages of XR Health is that a lot of parents um bring their child or suggest this to their child as therapy because of the video game aspect. And like I talked about before, it creates that buy-in. So I'm, like I said before, a massive video game nerd. So for me to create buy-in with a patient, that's a really huge talking point because I generally have played most of the games, if not all of the games that a lot of our clients play. And that creates interest and it feels like the client is being listened to. So I use that as a framework to build rapport and trust because that's a huge component of what we do is building trust within the therapy and what we're providing to in order to enable that child to look forward to their appointment, which is huge for us. So for me personally, it's using that knowledge of what I have from my like personal life and from my experience growing up. Like that's huge for creating that communication set with those clients.
Yeah, awesome. Yeah, de I can definitely relate to that. I've played a lot of games myself, though maybe not so much of the current ones. Got two kids, so hard to find the time to do so. But yeah, it's good. It's good fun being able to talk with our clients about like what game they're playing at the moment and how we can incorporate like a lot of their interests into what we do.
Mm.
Yeah. let's see here. Let's see. Do you work with adults or have other OTs who do?
Yeah, absolutely. Yeah. I've got a handful of adult clients that I see every week and still doing the same thing. It's using the virtual reality to target their goals, their occupational goals through the NDIS, or if they're private patients through their goals. But there's I guess it's more autistic clients that we see through autistic people that we see through in a pediatric sense, but the older patients, it's a much more variety, I suppose, of diagnoses that we see, but we definitely do get them in.
Yeah, absolutely. It's just like at the moment we're seeing a lot of kids coming through, but certainly we see a lot of adults too. And certainly our other OTs also have experience and work with adults. They've got adult clients at the moment as well. Um, so yeah, question about our fees. So with our headset, if you're seeing or if the client is seeing one of our services at least weekly, then there's no headset hire fee. And then if you're seeing us less than weekly, so fortnightly or monthly, then there is a headset hire fee of 135 per month. Let's see. Any other questions? Yeah, if any other questions come through, please send them, post them. We've still got a little bit of time. Let's see. Tim, any like common questions that, your clients tend to ask you in session in those
Um,
first sessions?
Ooh. I feel like we've covered a lot of them. Like I said, one of the biggest ones we get is putting their own games onto the headset. Can they play outside of therapy appointments? One of the biggest things that we see is, I guess, internet connection. We can kind of check at that first appointment how stable the internet connection is because that can present a challenge because you're streaming a stream as well as trying to let me tap into the headset, which I guess is a really cool function that I've not really touched on. That usually gets asked is, can I see what my child is doing during the session? And it's absolutely. We have a casting service where a parent or a caregiver can log in and watch exactly what they're seeing on screen, what I'm seeing on screen, what the patient's seeing on screen. So yeah, it's pretty good like that. But from a initial appointment, most of the questions I get asked are when will the headset arrive and can I put my own games on it? Which are the two definitely most common. I don't know if you're the same tongue.
Yes. Yeah. Our kids always ask, can we get Minecraft on it? Can we get
Yeah.
Roblox on it? No, no, we cannot, unfortunately. Awesome question. What's been your favorite moment with a client?
Ooh, that is a great question. Um, with XI Health specifically as well. Um, this is going to sound really silly, but my favorite moment was from a mum that told me a very teary comment that this is the first time she's seen her son engage so much with a therapist, and that he's had lots of therapy in the past where he just sits in the waiting room and he refused to go. And I guess that defensive avoidance type behavior. And this client comes to every single session. He's there early before I even get into the room with the headset on, ready to go. He tells me about his day. He tells me about all these things that he wants to do, and he's really opening up. For me, that's such a major win because the mum is super stoked. I'm just doing my job. It's awesome. So that's definitely one of my favorite moments, and I think because of that, I guess the fun element of the session that he's really connected with that and that's really worked for him specifically. So it's definitely one of my core memories from working at Extra Health so far.
Amazing. Oh, so nice.
Yeah.
Um, cool. So, you're saying the initial assessment takes 2 hours. What length are the sessions after that?
Yeah, so they're usually around 45 to 55 minutes. And then we've got some note taking time after that. And that also incorporates a little bit of preparation as well. So I usually do about 10, 15 minutes, depending on the client, before the session starts, just to try and get my plan in place for the session. And those are all, best intentions. I can go into a session with some really good plans, but you don't know what you're going to get when you walk into the or when you log into the session. So yeah, it's a little bit of prep time, and then we go from there. So yeah, 45 minutes to 55 minutes.
Perfect. Thank you. And just to clarify with that initial assessment of 2 hours, it's like an 1 hour of client facing time for the interview and assessment, and then 1 hour for the like really big notes afterwards. Yeah.
Yeah.
Okay. Notes and reports, sorry. Um, cool. Any other questions at the moment? Oh, it doesn't look like we've got any other questions coming through. But yeah, please, if you think of any questions after the webinar finishes, you can send them through to info.au@xr.health or give us a buzz. Um, and yeah, look out for the next webinar. Um, and thank you so much, Tim, for presenting.
Very
It's
welcome.
always great, hearing the OT perspective. But yeah, thank you everyone for joining us, and we'll see you at the next webinar.
Perfect. Thanks, everyone.
Thanks. Bye.